Dopamine is a neurotransmitter that plays a key role in regulating our behavior, mood, and cognitive functions. It's often referred to as the pleasure chemical because it's associated with feelings of pleasure, reward, and motivation. Dopamine is involved in many different processes in the brain, including learning, memory, attention, and decision-making. In this video, we'll explore the science behind dopamine and its impact on our behavior and well-being. What is dopamine and how does it work? Dopamine is a neurotransmitter that's produced in the midbrain and released into the brain's reward center, also known as the nucleus accumbens. It's involved in many different processes in the brain, including motivation, reward, and learning. Dopamine is produced by neurons in the ventral tegmental area, VTA, of the midbrain and released into the nucleus accumbens, where it binds to dopamine receptors on the surface of neurons. When dopamine is released, it triggers a chain reaction in the brain that leads to feelings of pleasure and reward. This process is known as the dopamine reward pathway. The reward pathway is activated when we engage in pleasurable activities like eating, sex, or drugs. When dopamine is released in response to these activities, it reinforces the behavior that led to the release of dopamine, making us more likely to engage in that behavior in the future. Dopamine's role in motivation and reward. Dopamine plays a crucial role in motivation and reward. When we accomplish a task or achieve a goal, dopamine is released in the brain, leading to feelings of pleasure and satisfaction. This reward system helps to motivate us to pursue goals and engage in behaviors that are beneficial to our survival and well-being. However, the dopamine reward pathway can also lead to addiction. When we engage in highly pleasurable activities like drug use, gambling, or overeating, the release of dopamine can become so powerful that it overrides our ability to make rational decisions. This can lead to a cycle of compulsive behavior that's difficult to break. Dopamine and addiction. The role of dopamine in addiction is a controversial topic in the field of neuroscience. Some researchers believe that addiction is primarily a result of changes in the brain's reward center, while others argue that addiction is a complex interplay between genetic, environmental, and social factors. One theory of addiction is that repeated exposure to drugs or other highly pleasurable activities can cause changes in the brain's reward circuitry, leading to a decrease in the sensitivity of dopamine receptors. This means that individuals may need to engage in higher levels of the behavior to achieve the same level of pleasure and reward. Dopamine and mental health. Dopamine is also involved in many different mental health conditions, including depression, anxiety, and schizophrenia. In depression, for example, there may be a decrease in the amount of dopamine released in the brain's reward center, leading to feelings of sadness and lethargy. In schizophrenia, there may be an overabundance of dopamine in certain areas of the brain, leading to hallucinations and delusions. Dopamine is also involved in attention deficit hyperactivity disorder, ADHD, as individuals with ADHD may have a decrease in the amount of dopamine released in the prefrontal cortex, leading to problems with attention and focus. The link between dopamine and decision-making. Dopamine is also involved in decision-making. When we're faced with a choice, dopamine is released in the brain to help us evaluate the potential rewards and risks of each option. This process is known as cost-benefit analysis. However, the dopamine reward pathway can also lead to impulsive decision-making. When we're presented with a highly pleasurable option, like a piece of cake or a drink, the release of dopamine can override our ability to make rational decisions. This can lead to behaviors that are harmful to our health and well-being, such as overeating or substance abuse. Medications that enhance dopamine neurotransmission. Levodopa. Levodopa is a medication commonly prescribed for Parkinson's disease. It is converted into dopamine in the brain and helps replenish dopamine levels. By increasing dopamine availability, levodopa improves motor symptoms such as tremors, rigidity, and bradykinesia. However, long-term use may lead to motor complications and fluctuations in symptom control. Dopamine agonists. Dopamine agonists are medications that directly stimulate dopamine receptors in the brain. They mimic the action of dopamine and can be used to manage Parkinson's disease or as adjunctive therapy in combination with levodopa. Common dopamine agonists include pramipexole, ropinirole, and rotigotine. They can help improve motor symptoms and reduce levodopa-related complications. Antipsychotics. Antipsychotic medications are used to treat conditions such as schizophrenia and bipolar disorder, which involve dopamine dysregulation. They work by blocking dopamine receptors, particularly the D2 receptors, to help reduce psychotic symptoms. Typical antipsychotics like haloperidol and atypical antipsychotics such as risperidone and olanzapine are commonly prescribed. ADHD medications. Certain medications used to treat ADHD, such as methylphenidate and amphetamines, increase dopamine levels in the brain. They enhance dopamine neurotransmission, leading to improved focus, attention, and impulse control. These medications are often prescribed for children and adults with ADHD to help manage symptoms and improve cognitive function. Antidepressants. Some antidepressant medications indirectly affect dopamine neurotransmission. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, increase the availability of serotonin and norepinephrine, which in turn can influence dopamine levels. These medications may help alleviate symptoms of depression, which is often associated with dopamine imbalances. Potential side effects and considerations. While medications that target dopamine receptors can be highly beneficial, they also carry potential side effects and considerations. It is important to discuss these with a healthcare provider to determine the most appropriate treatment plan and manage any potential risks. Common side effects of dopamine-enhancing medications may include nausea and gastrointestinal disturbances, drowsiness or sedation, changes in blood pressure or heart rate, restlessness or hyperactivity, sleep disturbances. Individual responses to medications can vary, and healthcare providers will closely monitor their patients for any adverse effects and adjust the dosage accordingly. How to increase dopamine naturally. There are many ways to naturally increase dopamine levels in the brain, including exercise, meditation, and spending time in nature. Exercise has been shown to increase dopamine release in the brain, leading to feelings of pleasure and motivation. Meditation has also been shown to increase dopamine levels in the brain, leading to feelings of calm and relaxation. Spending time in nature has been shown to increase dopamine release in the brain, leading to feelings of happiness and contentment. The dangers of dopamine overload. While dopamine is essential for our well-being, too much of a good thing can be harmful. Overstimulation of the dopamine reward pathway can lead to addiction, impulsive decision-making, and other harmful behaviors. For example, the overuse of technology can lead to a constant stream of dopamine release in the brain, leading to addiction and other negative effects on mental health. It's important to be mindful of our use of technology and other highly pleasurable activities to avoid overstimulating the dopamine reward pathway. Dopamine and technology. Technology has changed the way we interact with the world and with each other. The constant availability of social media, video games, and other forms of digital entertainment has led to a new type of addiction. Technology addiction. The overuse of technology can lead to a constant stream of dopamine release in the brain, leading to addiction and other negative effects on mental health. It's important to be mindful of our use of technology and to take breaks from screens to avoid overstimulating the dopamine reward pathway. Conclusion. Dopamine is a fascinating chemical that plays a vital role in our brain and behavior. It's involved in many different processes in the brain, including motivation, reward, and decision-making. Understanding the science of dopamine can help us gain insights into why we do what we do and how we can improve our mental and physical well-being. While dopamine is essential for our well-being, it's important to be mindful of our use of technology and other highly pleasurable activities to avoid overstimulating the dopamine reward pathway. By taking care of our mental and physical health, we can ensure that we're using dopamine in a way that's beneficial to our well-being. Thanks for watching.